Hi, I'm Dr. Sharon Celine, and I'm just waiting for all of our participants to let me know they're here so we can get started right away. If you could raise your hand and give a wave so I know that you're with us, that would be great. Um, I'll be able to send messages to all of you via the chat column, or you can ask questions there that everyone will see, or you can ask a question on the Q&A more privately. Why don't you raise your hand and say hi in the chat so that we can come together as a group. Thank you. Okay, people are saying hi. That's awesome. A couple more, waiting for a few more. Make sure on your chat that you've checked all panelists and attendees so we know that everybody's here. Okay, so I have 4 people who've raised their hand and about 5 people who've started on the chat. And it is now 8:01. So I am going to get started. Welcome to the first webinar of the series. As you know, my name is Dr. Sharon Celine, and we'll be spending the next 4 weeks together talking about what ADHD kids wish you knew and how you can help them. I'm very excited to be here. I'm also going to confess this is my first webinar, so I may hit a few bumps today, and I really appreciate your patience with me as I manage the technology. So today we're going to talk about what is ADHD, what are executive functions, and how do you obtain an accurate diagnosis and talk with your kids about ADHD, what role do medications play, and non-medical interventions, and then once you have a diagnosis, what's next? I want to remind you that these classes are being recorded and you will have access to them for as long as you want. So thank you for that. I guess I'd like to start first with my approach, which is the 5 C's of ADHD parenting. Now, some of you may know, and some of you have already read my book, What Your ADHD Child Wishes You Knew, Working Together to Empower Kids for Success in School and Life. And in that book, I articulate my parenting philosophy, and I'm grounded in a couple things. One is I believe that we should do more of what works. And we're going to try to find out what works by including our children in conversations about what their experience is like having ADHD and how we can work together to solve problems. This is a strength-based approach, which means we pay attention to and honor the things that the kids are already good at and want to get better at. And we also notice some of their weaknesses, and we try to work together to improve them. It also relies on something called attentive awareness, where we pay attention to what our children are showing us with their words and their bodies and their faces and their emotions as an effort to be more compassionate with them and to empathize with their daily experiences. So for my book, I interviewed dozens of kids with ADHD and talked to their parents. And I came up with what I consider to be an integrative collaborative approach that works with kids with ADHD to improve their buy-in and to help them reduce arguments. So there are 5 steps to more cooperation and building resiliency. And we're going to learn how to improve executive functioning skills at the same time. So what are the 5 C's? So the 5 C's are based on what kids told me about their experiences of living with ADHD. And the first one is that they really struggle when you are parents lose your control, your sense of control when you yell and you scream at them when they themselves are dysregulated. And so the first C is self-control. You manage yourself first and your feelings so you can act effectively and teach your child to do the same. The second C came from kids telling me that they would really like their parents to meet them where they are, to but not using that language, of course, but to understand that they're doing the best they can with the resources that they have available to them. And they don't always understand themselves, but they want you to understand them. And they want to be forgiven, even though they may not always forgive themselves. So the second C is compassion. We're going to meet kids where they are, not necessarily where you want them to be or expect them to be, and we're going to teach our children to do the same, to accept who themselves with ADHD. The third C came from pretty much every child I spoke to telling me that they want to participate in decisions and plans that have to do with them and their lives. And so the third C is collaboration. You're going to work together with your son or daughter to come up with solutions to daily problems and use incentives to help them stick with those plans and follow through. Which leads us to the next C, which is consistency. Now, we can't be consistent all the time, but what kids with ADHD told me is that it's very confusing for them when parents say one thing and do something else. And what works much better is if there is a routine and as much consistency as possible. And if there are exceptions to the routine or times when you're not consistent, that you give some explanation about why that's happening. But consistency is something else, and it's something that I call efforting. And that means that you fall down, you get up, you dance, you fall down, you get up, you dance. And so that is continuing to try things in the face of defeat, in the face of success. Whatever happens, you keep going. And for kids with ADHD, this is challenging. And sometimes it's the blessing of having ADHD because they don't hold on to things very long. They're not grudge holders. And sometimes it's one of the disappointments of ADHD because they get discouraged and they want to give up. They feel hopeless. So efforting is part of consistency, and we want to pay attention and value efforting. The last C has to do with positivity. Now, Dr. Barbara Fredrickson, who's an expert on positivity, has done a lot of research, and she found that the perfect positivity to negativity ratio is 3 to 1. So that means 3 positives for every negative. And as I've traveled the country and spoken with parents and educators and clinicians about this positivity ratio, I've asked them, what do you think the positivity ratio is for your child or student or client? And consistently, the number that I have heard is 1 to 15. So that's 1 positive for every 15 negatives. And so that just is not good enough. Because what happens is then that kids with ADHD develop a very strong pattern of negative self-talk, which brings them down. Celebration, the fifth C, is about kids wanting to be noticed for their efforts, for their progress, just as much as for the positive outcomes, maybe even more so. They want people to acknowledge and value what they're doing, and they also want to feel encouraged by their parents. So those are the 5 C's. So in your handout, you'll see a little exercise that I'd like you to fill out quickly right now. Which of these 5 C's do you think you struggle with the most? Which of these 5 C's comes easily to you? And which of your child's behaviors do you think is most going to trigger you and make it hard for you to use any of these 5 C's. So let's take a few minutes and have you write some of your answers down. And when you've written your answers down, raise your hand again or send a note in the chat that says you're finished. I see that a few people have raised their hands. As you finish, please raise your hand so I know we can move on to the next thing, or say something in the chat so we can move forward. Thank you. Okay, why don't you put your hands down so that the next time that I ask you to raise your hand, it will be something different. So let's talk a little bit about what is ADHD. Now, I understand that some of you may have kids who are diagnosed or just diagnosed or in the process of figuring things out. So we know that ADHD is a chronic condition marked by persistent inattention, hyperactivity, and sometimes impulsivity that is more frequent and severe than we see that is typically observed of children of the same age. It's a biologically based disorder related to the neurotransmitters dopamine and norepinephrine. And in order to receive a diagnosis of ADHD, you have to have 6 out of 9 symptoms for a period of 6 months in 2 settings. And usually for kids, that's home and school. For adults, that would be work and school. Excuse me, work and home. 2 out of 3 children who have ADHD continue to have symptoms as adults. 5 to 10% of kids with ADHD outgrow it. ADHD is the most inherited mental health condition. Basically, there's a 50% transmission from adults to children, which means if I see a child in my practice who has ADHD, there's a 50% chance that one of their biological parents will have it as well. If 50% of 57%, excuse me, of adults with ADHD have at least have one child with ADHD, and if you have one child with ADHD, there's a 3% chance of having a second child with ADHD. As we know, there are 3 types of ADHD: hyperactivity slash impulsivity, inattentive, and a combined type. The diagnosis for ADHD is made only after ruling out medical and other mental health or environmental concerns. And I have some notes here, so if you see me looking to the side, it's because I'm trying to, follow my notes to stay organized and on top of things. So ADHD is a productivity deficit. It's not an accuracy problem. It's a disorder of now. People can't people can't use what they know, and it reflects difficulties with performance, not intelligence. It's a disorder primarily of self-regulation and metacognition, which is a fancy word that means self-evaluation. And common traits of ADHD, of course, are fidgeting, restlessness, easily distracted, difficulty following instructions, maybe not appearing to listen, losing things, excessive talking, organizational difficulties, etc. A couple more facts about ADHD. It affects about 11% of the school-age population in the United States. The male to female ratio is 3 to 1, hyperactivity to inattentive type. Many kids with ADHD also have sensory processing challenges, peer relationship issues, anxiety and depression. In fact, the statistics for anxiety are about 35% of kids with ADHD. Depression can be anywhere from 9 to 34%. 70% of kids with ADHD have also have a learning disability. And 87% of kids with ADHD have a secondary diagnosis, whether that's anxiety, depression, and 40% of kids with ADHD have oppositional defiant disorder. Of course, ADHD changes over the years. When children start, if they're hyperactive and impulsive, it'll shift over time to inattentive type. And inattentive type will pretty much stay the same, and the combined type will also be more predominantly inattentive than combined. And this happens often around adolescence. Physical impulsivity will shift to verbal impulsivity, and inattention, as I said, stays the same. Of course, what I want to say is that ADHD refers to significant challenges with executive functioning deficits. Everybody with ADHD has significant challenges with executive functioning skills. Excuse me, I said deficit, so I apologize. And we all have executive functioning skills, and executive functioning skills are what I like to call the command center of the brain. And they live right here in our frontal lobes, and they connect and prioritize and integrate cognitive functions moment by moment. ADHD means that you have executive functioning challenges that are more severe and widespread than we would typically see in another child of a similar age. And executive functioning challenges can also be seen in autism spectrum disorders and learning disabilities. It's a broad term, executive functioning, used for the directive capacities of the brain. And I want you to think of it like a conductor of a band. So let's say that you're in a sound studio, you're in a recording studio, and the band is in the sound studio, and you're in the booth, and you need some more violins, so you ask for more violins, and you need fewer drums, so you ask for fewer drums. That process of choosing what you need more of and what you need less of is exactly what executive functions do. There's not a organ in the brain for executive functions. It's what the frontal lobes do. They direct the rest of the brain. And they integrate memory with what we see and feel right now. Executive functions are responsible for self-regulation. And when you're stressed or fatigued, guess what happens? That your weakest executive functioning skills fall apart. So executive functioning skills include several things, and I'm going to do something really nifty here, which is I'm going to pull up the graphic that you have on page 2 of your handouts of the executive functioning skills. These skills are a combination of thinking and doing skills, and they can be divided into what we call hot and cool skills. Hot skills are the ones that we're pretty much conscious of. So let's take a look at what those look like. Okay, so here we go. We have, can you see the hot skills on your screen? I hope you can, because I'm not sure about that. Hold on a second. Can you see the executive functioning skills on your screen? Could you let me know? Yes. Hold on a second. Okay, great. Okay, so thank you. So we have hot skills, and hot skills are inhibition. So how do we regulate ourselves? And that looks like being able to stop and think before you do something. So that's what we would consider to be impulse control. There's also emotional control. How do we control our feelings, especially anger? Well, how do we tolerate frustration? organization. How do you keep your personal items and family space neat enough that you can find things, that it's tidy, there's not scattered stuff everywhere. Time management, are you able to meet deadlines and correctly estimate how long things take? Planning and prioritizing, do you know where to start on projects, and can you decide what's most important? And of course, initiation, getting started, being able to start something without procrastination or excessive reminding. And this is where motivation comes in. So I'm going to stop that screen share, and I'm going to share the one on cool skills. Hold on a second. Here we go. So cool skills are the ones that are more unconscious. And hot skills respond very well to interventions because they're things that you can learn, that you're aware of. Cool skills are a little tougher because they're more unconscious. So one of the cool skills would have to be, sustained attention, what I call energy, alertness, sustained attention, information processing. How well are you able to maintain your attention without drifting off? Can you make consistent efforts and stay alert at what you're doing? Are you able to process information efficiently and not be overwhelmed all the time? Working memory, are you able to recall and follow steps in a series of directions? Can you think about of something that happened in the past and apply it to the present? That's one of the things that working memory does that's so important. It searches through our past experiences and applies information, lessons, behaviors to those things that are happening in the present. Many kids and adults with ADHD have they struggle quite a bit with working memory, and it is weaker than a number of other skills. And this makes school and work and remembering the directions that your mother just told you a lot harder. Shift flexibility has to do with the ability to change, to adjust to changes, to keep trying when you're struggling, and to make transitions smoothly. You can shift back and forth between things. Goal-directed persistence. You can set goals and stick with them until they're finished. Even when there's a distraction, you can turn away and come back to the task at hand. And finally, the last executive functioning skill to develop is what I call self-evaluation, also known as metacognition. And that's an awareness of your own behavior and whether you're able to show appropriate judgment. So let's talk a little bit about what this means for your son or daughter. And the way I want to talk about that is by saying one thing about working memory, and one more thing about working memory, and something about processing speed. So working memory is an essential aspect of executive functioning skills. It's like the computational space in your brain, and emotion drives this engine. Emotion lets us know whether something's important that we want to hold on to, that we think we should remember later on. Processing speed, which is not an executive functioning skill, but has to do with sustained attention and alertness, and it really affects being overwhelmed, and it's directly linked to working memory. And it allows a person to grasp and assimilate information efficiently. When people with ADHD are overwhelmed, it's because they can't process that information efficiently, and their working memory also is not able to help them. There's a favorite example that I have from one of my clients, which I call, the file example. And this was a 12-year-old, and she said, she feels overwhelmed all the time. And I said, well, tell me, why do you feel overwhelmed all the time? And she said, it's like a file comes into my head and the papers go everywhere. And I'm working really hard to pick up those papers and figure out where they're supposed to go. And then the next file comes in and those papers go everywhere. And then the next file comes in and those papers go everywhere. And I'm still working on the first file. And so processing speed, which is something you'll see when your kids are evaluated with something called a WISC, or you may see it, the Woodcock-Johnson will look at it as well. It's not an executive functioning skill, but it is directly related to executive functioning skills, and it's important for us to think about. So I want to say that we can't talk about executive functioning skills or ADHD without talking a little bit about the brain. And so here's a picture of the human brain. The brain develops from the back to the front and the inside out. And so it develops starting at the cerebellum and the brainstem up through the occipital lobe, the temporal lobe, the occipital lobe, the brainstem, the cerebellum, those are in the back of the brain. They develop first. They're often called the reptilian brain because we share that brain with reptiles. It's the physiological part of our brain. It's responsible for breathing and heart rate and blood pressure. The middle part of the brain, where we see the temporal lobe and the parietal lobe, that's considered to be the mammalian brain or the emotional brain. And the frontal lobe is considered to be the human brain or the thinking brain. And this brain is the last part of the brain to connect with the rest of the brain. And so it is completed in terms of its connectivity in neurotypical brains around age 25 and in ADHD brains around age 28. There's up to a 3-year lag in maturity of those connections. I want to basically, the brain has 2 hemispheres. It's connected by the corpus callosum, which is like the superhighway of the brain, and that is responsible often for the integration of details, sequences, and contexts. It's been found to be smaller in people with ADHD. There's also a part of the brain in the right frontal lobe that is responsible for processing emotion, and that also has been found to be smaller in people with ADHD. Neurons are very important because neurons are where all of the activity of the brain resides. And one of the reasons that we talk about neurons when we're talking about ADHD is because neurotransmitters are the ferries that take messages from one neuron to the next. And there are different kinds of ferries. You may have heard of serotonin. That's often related to anxiety and depression. Prozac and Zoloft are medications that target serotonin. For people with ADHD, the 2 major neurotransmitters that are most affected are dopamine and norepinephrine. And medication for ADHD does not create neurotransmitters. They facilitate the release and delay of their reuptake along critically important networks. What does that mean? People with ADHD make dopamine and norepinephrine normally, but their brains don't release it at the neuronal level, at that synapse that's in that box right there, and send it to the next neuron effectively or efficiently in areas of the brain that manage executive functions. So dopamine highlights what's important. It gives us rewards from activities, pleasure, and interest. ADHD folks release dopamine at a lower rate and which makes it more difficult to work up excitement about something unappealing. Norepinephrine is associated with sleep and alertness in the cerebellum, and it activates the areas of the brain involved in attention, concentration, behavioral control, and social judgment. Reduced norepinephrine is associated with inattention, drowsiness, and sleep. Okay, how are we doing? I am working through your handout as I look at mine. So I want to say a few things about medication. So stimulant medications have been used since the 1930s with a lot of research about their effects. Common side effects are mild insomnia, appetite suppressant, sometimes headaches. The drugs work because they increase the availability of dopamine and norepinephrine in those synapses so that they can do their jobs more efficiently. Taking ADHD medication has been found to reduce the risk of substance abuse later on in life because teenagers in particular or adults don't need to self-medicate. One of the benefits of medication is it can help the person distinguish between who that person really is and the symptoms of ADHD. They may act differently because they're not as distracted. Sometimes that's uncomfortable for people. Sometimes there can be an increase in aggression or anxiety. But the bottom line, whether you choose to use medication or not, and that's a very personal decision, is that pills don't teach skills. Even kids who take medication, they may have more efficient processing, but they still need to learn the effective executive functioning skills and create structures and patterns to help them live their lives efficiently. So, there are side effects about medication to consider, and you're all probably really aware of them. One side effect that I would ask you to consider about not taking medication would be the amount of suffering that your child or your family is experiencing. Some experts in ADHD will say, well, if you really should consider medication because otherwise you're thinking of, looking at years of failure, frustration, underachievement, and troubled relationships. That may or may not be true. You have to ask yourselves, what's the risk of taking the medication? But you also have to ask, what's the risk of not taking the medication? Because the effects are idiosyncratic. Now, of course, there are non-medication treatments for ADHD, which I will talk about in a minute. One thing I want to say is that recent research has shown that medication without mental health treatment is what's prominent. 62% of kids with ADHD receive medication alone, while only 47% receive behavioral health interventions along with their medication. And it decreases to 42% by the time kids are teenagers. And this to me is super troubling because taking the medication alone is not going to help you build and learn how to create the scaffolding that you need to live a successful life with your executive functioning challenges. Now, we all have executive functioning challenges. I myself struggle with time management and emotional control. I come from a long line of neurotic, passionate, high-strung Jewish women, and I like to have big feelings. And I know that about myself. So I know that those are two areas. Sometimes I can be a little inflexible on a trip in particular when I have an idea of how I want something to go. The rest of my executive functioning skills are intact and very strong. For people with ADHD, it's often the inverse. They have one or two executive functioning skills that they're really solid with, and then a number of them where they struggle. And that's why the behavioral interventions are so important. I want to say something about the stimulant medications, the different kinds of stimulant medications, as well as non-stimulant medications. So the stimulant medications that are familiar there are two major types. There's methylphenidate, which is what I call the Ritalin strain, and you'll have Ritalin, Concerta, Metadate, Metalin, Focalin. And I think the Daytrana patch is also a methylphenidate. And then the other strain of medications are what we call the amphetamine salts, and that would be dextroamphetamine, dexedrine, and dextroamphetamine compounds, Adderall, Adderall XR, Vyvanse. And then there's something called a magnesium I can't pronounce, Pemeline, a magnesium Pemeline, which is what we call Silert. Now, there are also non-stimulant medications, and they work slightly differently, and they tend to have fewer side effects in terms of appetite suppressant and insomnia and things like that. But they have other issues. Sometimes they can cause drowsiness, and sometimes they're not as effective. That would be Strattera, sometimes guanfacine, or we also know that as 10X or Intuitive. Sometimes the SSRI antidepressants can be helpful, and sometimes there are medications such as Wellbutrin or Effexor that can also assist kids and adults with ADHD. Now, what are the non-medication treatments? Because everybody's interested in those. One of the things that's highly recommended is adding omega-3 fatty acids to your diet and to your kids' diet right away. Those are very helpful, and they're helpful because they facilitate what a brain process called myelination. And myelination, remember, if we go back to that diagram of a neuron, it's the fatty sheath that encompasses a neuron, and it's basically like a coating that speeds up the passage of the message down the neuron. And so that's why, babies drink whole milk, and so omega-3s can be helpful with that. Exercise has been found to be extremely helpful for kids with ADHD. The endorphins are useful for the brain, plus they make them feel good, and it develops an alternative skill that's not academically based. A lot of times kids with ADHD, however, are not good at team sports. I found, that kids with ADHD often do better in what I call single team sports. So those would be things like swim team, martial arts, tennis, track, maybe fencing, where it's just one person. Sometimes kids with ADHD get overwhelmed in sports where there are lots of players on the field. Some kids can handle it, but I found that many do better at what I call these single team sports. And getting some sort of exercise, of course dance, I forgot dance, is really important. Ultimate Frisbee is one that a lot of, I know a lot of kids with ADHD like, and that is a team sport. But somehow the movement is not as rapid as it is in football or soccer. Cerebellar stimulation exercises such as brain gym, the Dory method, or kinesiology. The research on that really isn't very consistent, so I can't say much about it. It's also expensive. And then the final thing is biofeedback and neurofeedback, and there is increasingly positive research about both of those. Again, many insurance companies will not pay for that, but I know clients who've benefited from neurofeedback and whose parents have seen a difference. They still need to learn the skills. It all comes down to the skills, and that's what we're going to learn in this webinar over the next 4 classes. I want to say a few things about getting an accurate diagnosis, although many of you have a diagnosis for your kids already. It's really important to have a good evaluation so you can understand the pattern of strengths and weaknesses in your child's executive functioning skills, but also to get a cognitive profile of their functioning, and that's through the WISC or sometimes the Woodcock-Johnson. Achievement test is also helpful. That's often the Wyatt, to get a sense of where your child is in terms of his or her performance with peers. Most evaluations, however, won't actually be able to assess in those tests that I just mentioned in and of themselves for executive functioning deficits. Those do much better with what we call rating scales. And so a good assessment will be multidimensional. It'll take a thorough history. It'll have behavior checklists. It'll do psychological evaluations such as the ones that I mentioned, the WISC, or the WACE, depending on the age of your child. The Woodcock-Johnson is used sometimes, the Wyatt. Classroom observation, perhaps a work sample, and we need to rule out other possible conditions before we land on ADHD. And some of those rule outs might be post-traumatic stress disorder, anxiety, something biological that's going on. So I want to just take a pause right now, and if you have a question about what someone has just submitted a question, but if you have a question, please feel free to submit it in the chat room. I'm going to say Winnie, because everyone can see this, said our child is 6. With regarding to medication, is age a determining factor? That's a great question. You know, I have an ongoing conversation with a friend of mine who's a pediatrician here in Northampton. And what we notice is that for younger kids, parents are much more willing to try behavioral interventions because they're around their children more. And in elementary school, children have one teacher, sometimes a teacher's aide in a classroom. So there's more supervision and they can actually implement interventions more easily. As kids get older, that can become more complicated, and often parents are frustrated and kids are frustrated, and so they're more willing to turn to medication. So I don't know your child, so I can't say if 6 is too young. I have had in my practice and seen over the years 6-year-olds who started medication, and it made a world of difference for them. I've also had parents whose children were 6 and did not want to medicate them, and we did a lot of behavioral interventions, and that lasted for a few years. And then in the later years of elementary school, they decided to medicate their child because the child was struggling in school and having difficulty you know, basically attending, but also completing work. Again, if you have a question, please try to type it in the box. So let's discuss, how do you talk about ADHD with your child? So I have some strong feelings about this. One of the things I heard over and over again from kids is that no one wants to have a disorder. And if you could unraise your hand until I ask you to raise your hand, that would be really helpful. No one wants to have a disorder, and no one wants to have a learning disability. They consider that to be an inability, that they consider this to be, you know, a real blow to who they are as a person, a signal that there's something wrong with them. So in my office, for kids who are young, I would say in elementary school, I use the word attention wandering or fast brain, depending whether it's inattentive ADHD or hyperactive impulsive ADHD. And then I'll say to kids, well, you know, those are my words. How would you describe your brain? And so one person said, my brain is as fast as a bullet. Boom, I have a bullet brain. I'm like, okay, bullet brain. And somebody else says, I have a foggy brain. I just get foggy and I space out. We call it foggy brain. I don't use ADHD. Kids are uncomfortable with the disorder. As kids mature, however, into adolescence, they're much more aware of ADHD. Even the older kids in elementary school, you know, the foggy brain person I described, she knows what ADHD is. She just doesn't want to be associated with it. There's a boy in her class who has it, and she doesn't want to be considered in the same category as that boy. It's foggy brain all the time. That's what we call it. But as kids get older and they get into, you know, adolescence, they're more comfortable using the word ADHD. They don't like it, but it's much more in common parlance. I will still try to ask them to tell me about their brain. Describe your brain for me. I want to understand what you call your brain. That way we can have a more empathic connection with with them and with their brain, rather than try to lump it as a diagnosis, as something that is wrong with them. You know, you don't take a child to a doctor usually unless they're sick. And there are the well visits, of course. But most kids are pretty savvy and they know that they're going to the doctor because something is wrong with them. And we want to try to undo that thinking and language with kids with ADHD. They get so many negative messages. As I said, most people said that it was 1 to 15, not 3 to 1. And in fact, I was at a school in California this year, and I got to meet with a group of kids who see the learning specialist. And I asked them, you know, in terms of negative statements to positive statements, what would you say the ratio is? And one girl asked, "You mean what we say to ourselves or what other people say to us?" And I said, "Well, actually, I'm interested in the total." And the consensus among these 20 kids was that it was 30 to 1. I mean, 1 to 30. Oh my goodness, it would be great if it was 30 to 1. One positive for 30 negatives. So it's really important that we try to change that negativity by calling ADHD something that fits their brain. I have a quote here from Layla, age 14, and she says, "I feel like when people hear the word disorder, it makes them feel like they're not equal to people, excuse me, or they're different from others, or you're sick and you're not. Your brain's just different. Disability, I don't like that word either. When I hear the word disability, I think you have an inability to do things." Remember I said that earlier? No, which isn't true. No matter what you have, no matter who you are, you can do things. So by changing the language from disorder, which is outside of their daily experience, to a name for their brain that's inside their daily experience, it normalizes that they have a brain that's a foggy brain. I, Sharon, have a worry brain because I'm an expert worrier, and maybe mom also might have a brain that she calls a spacey brain, and dad has a brain that he calls a racing car brain. It doesn't matter. We want to try to normalize the experience so that everybody has a different kind of brain, and one brain isn't better than another. So you'll notice in your worksheet that the next exercise is for you to answer this question. What type of brain do you have, and how would you describe your child's brain? So again, when you're finished, please raise your hand so I'll know that we can move forward. Thank you. Okay, so it looks like about half of you are done. I'm going to move forward just in the interest of time and being able to have a question and answer period. So what do kids with ADHD want you to know about what it's like to have ADHD? So they're creative, out-of-the-box thinkers. One of my clients calls it ADLS. And I said, well, what's that? He said, attention deficit. Look, there's a squirrel, which I really like. Kara, age 10, tells me, I'm good with my imagination. Sometimes I think of something, and then I think of something else, and then I am way away from the first thing. Hector, age 15, says, I like the energy. I can do more than one thing at a time. But there are also numerous challenges. And some of these challenges are, sometimes I don't exactly hear all the stuff people say. I really don't hear it. And then I get in trouble because I miss something. Nona, age 10, tells me that. Dustin, age 16, tells me that my number one thing that I hate about having ADHD is my being late everywhere. I am bad with being on time, really bad. And Tyrone, age 12, says, not being able to focus when you want to. I have a very bad attention span. Really, I get really distracted easily. So how do we teach your kids the skills that they're going to need to manage their lives, to become successful, independent adults? It's going to take work. It's going to take a lot of repetition and patience. So there are lots of ways that you can, lots of types of support that you can utilize to get your kids on this path. One is therapy, family therapy in particular, as well as some individual therapy depending on the age of your child, but family therapy that's geared towards helping the family system live with ADHD and create routines and interventions for problematic behaviors together. Coaching can be very useful for kids with ADHD, particularly around schoolwork and getting things done. There's medication or those non-medication interventions. I'd like you to think for a minute, how does your child, or how do you want your child to best learn the skills that they need? Now, my 5 C's, as I said, relies on strength-based thinking and attentive awareness. So let's talk about those 5 C's so that you can walk away tonight with 5 tips on things you can start doing today or tomorrow with your kids. So let's start with self-control. So the idea with self-control is that when you are upset, you are basically taking kindling and throwing it on the fire that is your child. Nothing good's going to come out of that. The more that you become upset and dysregulated, either A, the child is now relieved of being upset because you're upset for them, or B, the child's just going to escalate. So I want to try to help you figure out how you can manage yourself. Now you've identified some triggers. So let's talk about this and what you can do. So of course there are breathing exercises, and there are a number of them. There's belly breathing, there's kids learn in school with mindfulness, they learn smell the flower, blow out the candle. And there's one of my favorites, which is from yoga, nostril breathing. And funny, I found that kids with ADHD really like this because it gives them something to do while they're breathing. So you take a finger and you put it on your nostril. Everybody do this. And you breathe in and you breathe out. And then you switch. And you switch. And it helps your whole system settle down. You do this several times and you do it together. And that's great. You can't always do that, but that's an option. Another option is for you, if you are dysregulated and you live in a house with another adult who is there, is for you to go to the bathroom and take a few minutes to yourself. There may be chaos on the other side of the door, but all children understand that parents go to the bathroom. And so going to the bathroom is a way that you can separate yourself from whatever's happening that's setting you on fire and get some stillness, get some perspective, and pull yourself together. You can look in the mirror and say a couple phrases to yourself like, I need to come, I have to take some deep breaths. I'm sweating the small stuff. I don't need to sweat the small stuff. You can wash your hands, wash your face, whatever it is you need to say. Maybe put a Post-it of the thing that you want to say to yourself on the mirror in the bathroom. And then when you're settled, you can go outside, because when you're more settled, you will think more clearly. It's like the airplane mask. It's like the mask on an airplane. They don't tell you to put the mask on your child first and then yourself. You put the mask on yourself and then on your child. So when you are calmer, when you are regulated, you are then able to act effectively and appropriately with your child. I think one of the challenges that happens with most parents and in families with ADHD is that things happen all of a sudden. All of a sudden there's a fire. All of a sudden there's an escalation. And then you don't have a plan for that, and so everything falls apart. One of the reasons I asked you to identify some of the triggers for you is so that you can be prepared, better prepared, when your child engages in these behaviors, which they do, that push that red button on your chest that says, react, and you can prepare and plan for how you want to respond to that. You can also set up a plan for issues that emerge in your family. And I call this plan Stop, Think, Act. Most of us act, and then we stop, and then we think about it. And so what we want to do is reverse that process. We want to call a pause in the action. And you can't do this unless you have a conversation about stop, think, act with the whole family to make a plan about it. So if you call a pause in the action, what does that pause look like? Now, I've seen parents set the timer. I've seen parents say 15 minutes, and even for little kids, they might sit on a couch and read a story. They may color. They might create a calm me down box, or whatever you want to call it, which has coloring books or Legos or something. For teenagers, it might be a playlist of music. It might be places people go. I had one little girl who liked to go under her bed where she had a book and a flashlight. I had another little boy who liked to, they had a bunny, and he liked to be able to go in and hang out with the bunny when he was upset. So you want to have a conversation. When we call a stop in our family, what does that mean? And what that means is everything stops. And then you launch into the plan of stop and how that's going to go. Then there's think. So after the stop, when people are settled, you come back together to talk about what's going on. And this means mostly reflective listening and observing on your part. Your child will say, I didn't like when so-and-so and such and such, and you say, I hear you say that you didn't like when so-and-so and such and such, and how would you have liked it to go? Your child is calmer now. I want you to think about what we call the amygdala hijack. Everybody's heard of this. And if you think about it, this is your brain. It's a little bad, but this is your brain. Daniel Siegel came up with this. And so this is the middle of your brain, that mammalian brain, that emotional brain. And when you're upset, it comes out and it hijacks that thinking brain. And so it's running the show. And when people have stopped and actually slowed down, then it goes back into place. One of the reasons I find calm down to be completely useless is it doesn't tell people what to do when they're upset. They need to slow it down. And when there are upsets in the family, we're going to slow things down. So you stop, you think, you have a little discussion about what happened, what could have happened, what you'd like to see differently, what you're going to do now, and then you act. So that is self-control. Compassion really involves reflective listening. I heard you say this. Did I get it right? Is there anything else? You don't process with them. You don't interpret. You just listen. Kids need to feel heard just like adults need to feel heard. And sometimes what we do as adults is we problem solve. We jump in. We tell them what we think they should do differently or how it should go or what would be better. For compassion to really work, for you to understand what it's like to walk a day in their shoes, really means observing what they're showing you with their words and their behavior and their emotions, but also asking and listening, reflective listening. Collaboration is more complicated. We're going to be dealing with collaboration in depth in the next several sessions, but essentially what that means is that you work together for solutions based on negotiation and compromise and buy-in. And you discuss meaningful incentives in advance and you use them. And meaningful incentives are things that matter to kids. They're not bribes. A bribe is, here's $5, now I want you to go shovel the snow. An incentive is when you shovel the snow and it's done, I will give you $5. And that's how we all learn to do things. And it has to do with motivation, which I'm going to talk a little bit more about next week. So when parents take things away, what I've heard over and over again from kids is it doesn't work because they keep asking for other things, and then they'll, until they annoy you and you give up and you give them something, you give in. And that's one scenario. The other scenario is that you threaten and you take things away, and you take so many things away that there's nothing left and it's meaningless. So punishment has been found over and over again not to work. And what we want to do instead is collaborate with incentives. And that means that you sit down and you have a conversation about what's meaningful, what's the task you want to get done, what's the behavior you're aiming for, and how you're going to get there by using incentives. We will talk about this more in depth in the next 2 times. Consistency is also one we're going to talk about, but it has to do with creating routines and following through with them, except when you can't. And when you can't, that's fine, but you need to explain why you can't. If you have a limited, if you say your kids can watch a half hour of TV when they get home from school, and that day they've watched their half hour, but you get a call at 5:30 from your mother that your aunt's in the hospital, and you have dinner on the stove, and your kids are running around, it's okay to say, you can have TV right now, a half hour. Your aunt is, there's something important going on in the family. I'll talk with you about it later. And then you can talk to them later and say, well, Aunt so-and-so is sick, and Grandma called to talk about it with me. And that's why you got to watch TV. It was an exception. It was a special thing. It's not going to happen all the time. And then that helps kids understand. Kids with ADHD really like to have structure and plans, even though they'll push against it, because it helps them organize themselves in ways that they can't organize themselves on their own. And so we're going to talk more about how to create routines that work. And usually that means cutting down on your expectations of what you want them to do and making a visual guide. And if your child doesn't read, that means pictures. But for kids who can read, it means a list of things that they do, that you want them to do, that they can check off. And in that list, there'll be a couple things that they already can do so that they don't feel defeated if they can't do all of the other things. But you have some things that they can do and some things they're working toward. And then you incentivize that. And the last thing is celebration. Now this you can start right away, and I really would encourage you to do so. Celebration is not about fake praise or, hey, wow, you cleared the table. You're the best child in the whole world. It's like, hey, you cleared the table. High five. Thanks. I appreciate it. Or, you know what? I noticed that you put your lunchbox on the counter the way I asked you to. Thanks. Or, wow, you picked up all the clothes from the floor of your room. Thank you. That is what celebration is. Or, hey, you know what? I noticed that your teacher really liked your painting and said, good job. That's fantastic. Many people will say praising children is wrong and it's bad. And I will say to those people, you're not raising kids with ADHD, because kids with ADHD have a negative pattern of self-talk that is so strong that they need to hear encouragement and validation from the outside to counterbalance it. So I would encourage you to start every day with trying to find 3 things that you like that your child does over the course of the day. And you can even have your child think of some things that they like about themselves. In my family, when I was raising my kids, we did highs and lows every night at dinner. And sometimes people rolled their eyes. But what was nice about that was I got to hear something about what was good about their day and something that wasn't. For kids with ADHD, you could just do 2 highs of the day. If you want to hear a low, you can, but I'm sure they'll tell you the low anyway. But you could start with what are 2 good things that happened when you pick your child up from school, or you're walking home from school, or daycare, or aftercare, excuse me, or you're at the table. Everybody could say 2 things about their day. I think we're a culture where we don't really pay attention enough to positivity. So I'd like to pause now and take some questions. We have 15 minutes left. This is a great time for you to ask me about things that we talked about today or things that you want to make sure I'm going to cover in the future in this webinar. So please type your message in the chat and we'll get started. Okay, you must have some questions out there. How would you handle a child who is easily frustrated and refuses to work with me? That's a great question. Thank you, Christina. Um, Kids who are frustrated easily and won't work with you are struggling in a few areas. The first area is that they don't really understand themselves or their limits, and they're usually being asked to do something that's beyond what they can actually accomplish. And so we want to try to help them lower their frustration by figuring out why the task feels too big and what could make it be stronger. Refusing to work with you is complicated. Teenagers will naturally push their parents away. They don't really want to be taught or anything, or sometimes, or corrected particularly. And so what we want to do instead is create a model that says, look, this yelling isn't working for you, and it's not working for me. And I can tell that it's not working for you because you're unhappy, you're stomping around. So we want to try to come up with something. And I know that a lot of times I make you do things my way. So let's try to come up with something where you get to do some of it your way and some of it my way. Entice them with the idea of compromise, and then do it. Even if their suggestions are, 99% impossible to incorporate, try to incorporate the 1% that you can. How do you handle all the anxieties coming out as soon as they go to bed? Nighttime takes forever despite consistency and routine. What are we missing? That is so true. Thank you so much for bringing that up, Mary. I hope I'm not pronouncing your name incorrectly. Bedtime anxieties. So bedtime is a common time when kids let down their guard and all of their worries come out. Worries about sleeping, worries about school, friends, family members. It all comes up before bed. And of course, you want to try to put your child to bed so you can have a few minutes to yourself, or maybe you could just go to sleep as well. The nighttime routine, it sounds like, is taking forever despite consistency and routine, probably because your child can't figure out how to self-soothe and is relying on you to reassure them and make them feel safe and comfortable. Now, for younger children, this makes sense to me, kids who are 5, 6, 7, even 8. But by the time a child is 9 or 10, they should be developing some skills to be able to put themselves to bed. And so this is a good time to use the 5 C's. You control your frustration, although you can name it and say, I'm frustrated because bedtime is taking too long. You use your compassion. You ask about why they think the anxieties decide to come up right before bed. Can you make an anxiety motel where they write down each of their anxieties, put it in a box, and then in the morning pick it up so they can take them back? Is there something that you could do that would help them? Is there maybe an app? Some of these apps are really great for listening to, for helping kids go to sleep. I had one girl, this was before the age of apps, who had a CD. It was like the Sleepy Bunny, Bye-Bye Time, something or another. And she played it every night. Her parents, they had their routine. They'd read to her, and then she'd listen to her app. But I think the other issue is that your child is using this time to talk about the anxieties that aren't perhaps being talked about at other times of the day. So I would want to know, is there another time of the day before bed that you could maybe discuss for 5 minutes of one particular worry and put that aside, or make a list of the worries, take one off the list, and just come back to the list tomorrow. So try to think creatively and to work with that anxiety. I will actually keep in mind this issue, and we can talk about it in 2 classes when we talk about home routines. Because this is a common one. So I don't think you're missing anything. I think that the problem is that your son or daughter can't self-soothe and therefore is relying on you to do that. So what would be better is to have a conversation about what would help them. And of course, if the answer is nothing, only you, then you're going to have to start to wean yourself out of that routine. And that might be going from sitting on the bed to sitting on the floor next to the bed, to sitting on a chair in the room, to sitting in the doorway, to sitting outside the room, but to kind of move, to shift it around. Winnie tells me that your son, that your child does great, awesome in Taekwondo, terrific, that's awesome, but struggles with team sports like soccer. Yeah. Should you stay with team sports to help him build the scaffolding? Team play is a very important life skill. Well, that's a good question. I think if he's not really liking soccer, I might try one of those, what I call individual team sports, or those single team sports, where he would be involved and part of a team, but get to do more of his own thing. So let's come back to that. Team play is an important life skill, but he probably will get those kinds of skills in group projects and things like that. And if he's on a rowing, a crew team, he's part of the team, but he's doing his own thing. If he's on the tennis team, he's part of the team, but he's doing his own thing. So maybe to try to find a different sport. Again, for some reason, ultimate frisbee doesn't seem to be as challenging for some of these kids, so that might be something to consider. Are there natural ADHD meds? You know, I'm not really familiar with natural ADHD meds other than the omega-3 fish oils. Those are the ones that I have had research, as well as some of the positive research about neurofeedback and exercise. So I tend to sort of emphasize the ones that I know about more than the ones that I don't know about. And someone has a question in the Q&A, so hold on a second. Anne says that your son was diagnosed with a Vanderbilt assessment. Would you recommend a neuropsych evaluation as well? I would. I think that the Vanderbilt is a fairly cursory tool that doesn't actually provide a multidimensional assessment, which is what we want. And so it doesn't, you know, it has to be a psycho-ed assessment, which would be the things that I mentioned, a WISC, a WACE, they might do a Bender Gestalt, or a different kind of visual spatial, which I'm blanking out on the name. They'll do something called they might do a BASC or a CBCL, which are checklists. They'll probably do something called the brief, which helps assess executive functioning skills. And then you get a very vivid and detailed portrait of who your child is and how their brain works. So I'm a big fan of them. Can I clarify something about the bedtime routine? My kids are 13 and 15, and my husband and I still rub them for 10 minutes each night. It's a nice time to check in with them and help them transition to sleep. Is this not a good idea? No, that is awesome. I think that's great. I'm talking about lying in bed with your child who's 13 for 30 minutes so that they can fall asleep knowing that you're there because they can't fall asleep on their own. I'm not talking about this. Bedtime is the best time to talk with kids about what's going on. It's when their guard is down, they're more open. I can't tell you how many parents of teenagers have complained to me how they have to prop their eyes open with toothpicks at 10 o'clock at night because their daughter wants to tell them the most important thing that happened to them in their day or a deep secret. So yes, please do that. That sounds fantastic, Mary Ellen. Phones and social media are such a problem. Most of my fifth grader friends have phones, but with ADHD and a 3-year executive functioning delay, there is no way she can handle a phone. How do I deal with this? Because she's starting to exclude her socially. Okay, I'm going to come back to this because there are a couple more questions. We're going to be talking about phones in class 4. So let's come back to that, Christina. Ruhi asks, any advice on how to stick with something? My child goes all in, but it fizzles out. So it fizzles out because kids get bored, and also because usually the task is too big. You want to have, we're going to talk about this next time, short working periods and short specific tasks that they can accomplish and then move on to the next thing. You've had some success with a weighted blanket. Why that helps? You know, that's a great point, Mari. I think there's something about feeling the blanket on the body that calms the system, the senses, the process, the sensory processing. As I said, many kids with ADHD also have sensory processing issues, like for instance, they're very sensitive to tags on their clothes. And so there's something about a blanket that makes you feel, you know, cocooned, you're bundled in, and that can kind of help kids relax and let go. Again, thoughts on screen time. This is a super big topic. I'm just going to go back to what Christina said. Recently, there's been research about how many kids under the age of 10 have cell phones, have their own plans, and physicians in particular are extremely concerned about this because kids are not ready, as you said, for phones. They don't understand how to work them, but their friends have phones. And I think sometimes what can be a good balance for that is to let them have a device that allows for texting and phone calls, but not any of the social media. Middle school kids really don't understand how to use social media, even though they use it all the time. And so the longer that you can put off giving your kids social media apps, the better. And we're going to talk in class 4 about screens and technology because it's a huge issue in many families with and living with and without ADHD. In terms of screen time, I'll come back to that because I'm going to talk about that next week when we talk about incentives. You want to use screen time to serve your goals, not to serve their needs. So if that means that your child can have half an hour of screen time a day, let them have the screen time while you're cooking dinner. We're going to talk a little bit about how to get on and off screens without fighting in future classes. If you have any other questions, please feel free to email your questions to me and I will save them for the next session. Or you can save your questions for next time. Next time we're going to be talking about school, interventions, assessment, and how to help your kids go through each school day feeling better about themselves and feel more academically successful. Thank you all very much for coming. Again, please feel free to email me any questions and I will see you next week. You will receive next Monday, as you did this Monday, your handouts for the Wednesday session, so you can go ahead and preview and fill those out as well. Okay, thanks so much. It was great to have you. I really appreciate your showing up. And next week, I will explain the demographics of the group from the survey. We didn't get to talk about that today. Have a good week. And here's to happy parenting. Goodbye.